kid. Yeah, you. Come here a minute. I got a hot tip for you. You want help to remember the features of TTPHUS? Just remember, nasty fever torched his kidneys. Neurologic problems like seizure or coma. Fever, thrombocytopenia, hemolytic anemia, and kidney failure. You can't have hemolytic uremic syndrome without hemolysis and uremia, and you can't have uremia without kidney failure, right? Forget about it. So yeah, nasty fever torched his kidneys. Pretty good, huh? Say, did I ever tell you about the time that me and Paulie Finelli torched that car? Paulie got a little too close to the fire, and that's how come we call him Paulie No-Brows. Now go on, get out of here. Better hit those books. He's a good kid, that one. Not cut out for our thing, but a good kid just the same. How you doing? I'm Jimmy Snake Eyes, and I got a very important question for you. Which cholinesterase inhibitor is used to make the diagnosis of myasthenia gravis? Hey, that's right, edrophonium. Look at you saying the right answers and everything. All right, here's another one. Which cholinesterase inhibitor is used to treat myasthenia gravis? Right again, pyridostigmine, which gets rid of myasthenia. You can also use steroids and immunosuppressants. And what surgical procedure is sometimes helpful? Thymectomy, because most patients with myasthenia have some kind of thymus pathology. All right, smart guy, get out of here. Back to the books. I said beat it. Scram. Why I oughta. How you doing? I'm Jimmy Snake Eyes, and I got some very important questions for you. Which type of interferon is used to treat viral hepatitis? That's right, interferon alpha. Not bad, not bad. All right, which hepatitis viruses can be treated with interferon alpha? Right again, hepatitis B and hepatitis C. Here's how I keep it straight. If you think of interferon alpha as interferon A, you can remember interferon A treats hepatitis B and C. A, B, C. Pretty good, huh? Interferon alpha can also be used to treat certain malignancies, like hairy cell leukemia and Kaposi sarcoma. All right, last question. What disease is treated with interferon beta? Multiple sclerosis. Say, that reminds me of the time I was indicted on multiple counts of interferon with a federal investigation. But seriously, kids, obstruction of justice is no laughing matter. So keep your nose clean, and say no to drugs, and eat your vegetables, and look both ways before crossing the street. How you doing? I'm Jimmy Snake Eyes, and I got some very important questions for you about ovarian tumors. Hey, this is high-yield stuff, so pay attention. First off, what imaging modality is preferred to evaluate and follow ovarian masses? Right, ultrasound. Hey, this kid's good. Next, which ovarian mass can be associated with psammoma bodies? Serous cystadenocarcinoma. Right again. Remember, psammoma bodies are concentric rings of calcification seen on pathology. They can also be seen in other cancers, like papillary thyroid cancer, melanotic schwannomas, and so on. All right, smart guy, try this on for size. Which type of sex-cord stromal cell tumor produces androgens? Huh? Sertoli-Leydig cell tumors, named after my paisano, Enrico Sertoli, and some German guy. Last question. What kind of tumor contains tissues derived from the ectoderm? A cystic teratoma, also known as a dermoid cyst. They can contain all sorts of tissue like hair, bone, teeth. Ew! That's some freak show stuff right there. If they ever pull something with hair and teeth out of my wife, I'm naming him Jimmy Jr. Forget about it. How you doing? I'm Jimmy Snake Eyes, and I got a very important question for you. Which two beta blockers are indicated for the treatment of chronic heart failure? That's right, carvedilol and metoprolol. Hey, wait a minute. Which kind of metoprolol? Long-acting metoprolol. Goes by the brand name Toprol XL. Don't get sloppy like that. Stay on your toes. I got my eyes on you. All right, wise guy. Which beta blocker is indicated for acute decompensated CHF, huh? Oh, gotcha! Beta blockers are contraindicated in acute CHF because they depress myocardial contractility. Pay attention, will ya? I tell you what, kids these days, they think they know everything. Why, I oughta